The International Diabetes Federation has estimated that globally 537 million adults are living with diabetes. And according to the Centers for Disease Control and Prevention, that is the CDC, 37.3 million of these adults are in the US. That is 11.3% of the US population. And 1 in 5 of them don't know they have it. Now, why is diabetes a major health concern? According to a study commissioned by the American Diabetes Association in 2017, the total cost of diagnosed diabetes in the US approximated 327 billion US dollars. Now, on the average, it is said that the medical expenditure of those having diabetes is about 2.3 times higher than the expenditure would be in the absence of diabetes. Hi, I'm Dr. Francisca Osage, and thank you for joining me on Francisca on Health Matters. Now, what is diabetes? This is a chronic medical condition of high blood glucose levels as a result of the lack of the hormone insulin or the inadequate response of the body to insulin. And based on causes, there are three main categories of diabetes. You have the type 1 diabetes, in which the pancreas has lost its ability to secrete adequate amounts of insulin, and this is found in autoimmune processes. There's the type 2 diabetes, in which the pancreas secretes insulin. However, the body cells are less sensitive to insulin. And then there's a gestational diabetes that occurs during pregnancy. Now, there are other subcategories of diabetes based on the causes, or what we call etiology. There's what we call the monogenic diabetic syndrome, and this can be found in infants. There's diabetes as a result of diseases of the pancreas, which secretes insulin, and such is found in cystic fibrosis, in some forms of pancreatitis. There's also drug-induced diabetes, and this could be as a result of the chronic use of drugs such as steroids. For the purpose of this discussion, we're going to focus more on type 2 diabetes. And this is not to undermine the medical, social, and economic significance of the other kinds of diabetes. Normally, glucose is derived from the breakdown of carbohydrates. After digestion and absorption, glucose is made available into the bloodstream. Now, the primary use of glucose is in the production of ATP, adenosine triphosphate. And ATP provides energy for cells to carry out their function. For this to happen, however, glucose has to be driven into the cell. And here comes the function of insulin. Insulin is a hormone produced and secreted by special cells in the pancreas in response to high blood glucose levels. In diabetes, problems arise from a lack of insulin production, as in type 1 diabetes, or decreased sensitivity of the cells to insulin. This results in a backup of glucose in the bloodstream, leading to hyperglycemia and decreased availability of glucose within the cell. Now, over time, especially with poor glucose control, tiny blood vessels become affected. These vessels are seen in areas such as the retina of the eyes, the nerve supply to the extremities, the vessels serving parts of the kidney tissues. Hence, the manifestation of problems within the retina of the eye, which can ultimately lead to blindness. On the extremities are sensations of tingling, then numbness, which can eventually lead to ulcers. On the kidney, symptoms initially aren't apparent, but there will be signs of good amounts of proteins in the urine, which is not normal. And over time, this can lead to a failure, and at this time, several symptoms relating to the failing kidney become apparent. In the long term, effects of diabetes will be observed in the bigger blood vessels, which become narrowed due to the accumulation of fatty-like substances causing obstruction within the vessels. Such can be seen in the blood vessel supply to the heart and the brain, amongst other organs of the body. These can manifest with problems such as myocardial ischemia, in which heart muscles are deprived of blood distribution and undergo destruction. Within the brain, the effect could cause a stroke. Now, with the onset of diabetes are the manifestations of a range of symptoms, which include increased sensation of thirst and thus increased intake of water, increased urination, increased food intake, as well as the constant feeling of fatigue. Now, in the management of diabetes, screening plays a very crucial role in controlling its incidence, and certain criteria are used to screen for persons who do not necessarily exhibit symptoms. And what are these criteria? We have the presence of protein in urine, the presence of obesity, the presence of a positive family history, and also the presence of elevated blood pressure, that is, blood pressure above 135 over 80. Now, these are criteria used to screen for diabetes. Now, lifestyle adjustments are also encouraged. This will include exercise, weight loss, and a diet that is mostly of a low caloric intake and fused with vegetables and fruits. For the management with the use of medicines in type 2 diabetes, different options are considered and available depending on the individual requirement. For example, there might be the need for weight loss, or there might be a compromise with the liver or kidney, or issues with the heart, or it might just be a case of individual preference. These medicines have a whole range of action, from direct or indirect effects of pancreatic insulin secretion to slowing the absorption of glucose from the guts or small intestine to mimicking the effect of insulin or increasing the body's cell sensitivity to insulin. Another crucial part in the management of diabetes is the monitoring of blood glucose. Now, this could be done around mealtime, daily. These days, however, there are patches that could be worn that can actually give a live information about the blood glucose level. There is also the periodic assessment of blood glucose control by assessment of a parameter called the HbA1c, that is the glycosylated hemoglobin. And this gives information of a long-term control of blood glucose levels. This can be done every 6 months, especially in the case where the blood glucose level is controlled. However, in the case of a poor glucose control, this can be done every 3 months. Now, type 2 diabetes, which is the most prevalent of the diabetes, is highly attributable to lifestyle choices. Hence, the importance of making right decisions towards reducing the incidence of diabetes. And what are these choices? This will include eating right, maintaining a healthy weight, and engaging in exercises. This will go a long way in reducing the prevalence of diabetes. Again, I hope you found this informative and educative. And if you have, please subscribe, and I'll see you in the next one.